Two parts. One was my partner, Jerry Ashton, is more of a, I don't know, he's an activist. So when he heard about Occupy Wall Street, of all things, he went down to Zuccotti Park. He only lived a couple of train stations down. And he was a Navy journalist, so he actually brought his pad and he started interviewing people, chronicling this movement. And it was about disparity and inequity. And he says, Craig, this is really for real down here. I said, oh, that's interesting. I just came across some other people that are down here and they want to abolish medical debt. Wow. He said, they asked me, what do you think of this, Jerry? We're going to raise $50,000. We're going to buy $1 million of medical debt, and then we're going to abolish it. And he goes, I think that's the dumbest thing I've ever heard.
So the inspiration wasn't right away.
It wasn't right away. Well, what happened was they came up with this idea, so we were inspired by it, but we actually helped them abolish over $40 million.
How do you go
of
about
debt.
doing that?
You go to the providers, the doctors, the hospitals, even the collectors, the people that actually buy debt to collect it. There's a market for that.
Okay.
And then we buy it just the same price that an investor would buy it for, but instead of collecting on it, we wipe it out, take it off their credit report. So we're using a mechanism that's used to make money, and we're using it in reverse. We're not a collection agency, we're a collection debt forgiver.
Quantify this a little bit more for us, Craig. How much money has R.I.P. actually allotted to helping patients with crippling debt?
We have abolished over $400 million of medical debt for almost 250,000 people. Now, people come to us and say, can you help me? Well, I can't help people directly.
Okay.
What I do is, I'm able to go to a hospital and say, here, you have $100 million of debt from 100,000 people. They can't pay you. They might not ever pay you. Or, like you said with your mother, she might actually pay more than she should.
Yeah,
and at the end of the month, she might not have enough to pay for food or decide not to go to the doctor. Well, we're trying to take that hardship away. And what we do is we'll tell to the hospital, we'll tell them, we'll buy that $100 million of debt for $750,000 or $1 million. And sometimes you do things that are way out there to help other people, and you really need to know, am I doing the right thing?
How much did your faith play in this?
Oh my God. I mean, if it wasn't for my faith, I wouldn't have done it, because I just knew it would work. But it took 2.5 to 3 years before I could even take a salary.
So you put yourself at risk to help other people. Is that the way you were seeing
That's
it?
how it was. It was. My wife would say, why are we going into debt to help people get out of debt? I'm like, because we're the only ones that can really do this. I come from the collection industry. I know it. But I didn't know how it was going to work. We had to be miracle ready for it to happen.
In the time we have left, Craig, as I told you, I'm fearful for my parents because they're aging and they're really ill. If someone is drowning in medical debt, how can they contact you for help?
Yeah, they don't contact me for help. What they do is they have to know their rights. When they go to a hospital, for example, they have to know if they make less than 2 times the poverty level, they get charity care from that hospital. No charge. So you have to know your rights.
Okay, Craig, thank you so much for being here. This is such an important topic. I really appreciate your
You're
insight.
welcome. Thank you so much, Liz.